Good afternoon. My name is Tiffany Wojciechowski. I'm a caseworker assigned to assist Andy, a 12-year-old child of older parents. Andy has a history of performing well on multiple choice exams, although he has difficulty organizing his thoughts for written work. When Andy has been asked by his teachers to present information, he has a history of having trouble with his verbal delivery. Andy has friends through his church and junior baseball team. Andy has been referred to me to help in diagnosing Andy due to his inability to organize his ideas and communicate effectively. That has begun to impact his daily life. Andy's parents have reported that has passed a preschool entrance medical examination as well with no medical issues present. In diagnosing Andy, what is referred to ADHD or attention deficit disorder in reference to DSM-5, diagnostic criteria A through E. Criteria A, ADHD symptoms. The criteria must present at least 6 symptoms in adolescents from before the age of 12. Symptoms present before age of 12 and ongoing include the difficulty to organize thoughts, but can maintain multiple choice questions, inability to organize ideas or communicate effectively his verbal answers or thoughts. However, in this case scenario, there are not enough symptoms present for a valid case of ADHD. In a valid case of ADHD, symptoms must include the following to be considered through DSM 5 as a valid case. Symptoms must be present before the age of 12 years old. CDC Gov. Several symptoms must be present for two or more locations since his home or work. Also from CDC.gov. There must be a clear evidence that the symptoms must interfere with social, school, or work environments. Also from CDC.gov. The symptoms are not better explained by another mental or mood disorder and are appropriate for developmental level, which means they cannot be better explained from another medical condition. Also from CDC.gov. ADHD is a neurodevelopmental disorder that is classified by different levels of inattentiveness, hyperactivity, impulsive impulsiveness that affects the patient's daily activities. From neurolaunch.com. With ADHD not being a valid diagnosis, there are other neurodevelopmental disorders that coexist with ADHD. One specific is specific learning disability, or SLD. SLD is a learning disability that meets the criteria for Andy's case. A patient would have to meet 4 of the criteria to be diagnosed by DSM 5 for SLD. The first is having difficulty in one of the learning areas for at least 6 months despite targeting help. That's psychology.org. Having difficulty reading, understanding the meaning of what is being read, spelling, written expression, number concept, and or mathematical reasoning. Psychiatry.org. Having difficulty with academic skills that are below normal and cause problems in school. Psychiatry.org. The problems start during school age. Learning difficulties are not caused by another medical condition, also both from psychiatry.org. One specific diagnosis would be dysgraphia. This is where the patient has writing disabilities, where the brain has problems with organizing and processing the motor skills needed to understand the writing on paper. TheKingsleyClinic.com. One example is inability to break down words into syllables and recognizing words that rhyme from psychology.org. However, in order to diagnose this condition rather than SLD, more information would need to be known to fit the criteria for the condition about the writing of verbal communication problems that Andy is having. One way to diagnose SLD and specific other related conditions would be to have an academic test from the school or an outside source to do the testing to be able to properly diagnose SLD, and if any other conditions related to the condition. In order to diagnose if the condition is mild, moderate, or severe, additional testing would be performed on the patient. Under federal law, the Individuals with Disabilities Act requires schools to test if any child is suspected of having a learning disability. Psychology.org. Another form of testing besides academic testing would be neurological testing to see how the child thinks in order to diagnose. In order to provide treatment, testing and diagnosis would ensure Treatment options would be there if no underlying medical issue causing the condition would be to tailor a specific learning plan to teach the patient skills and a learning plan based on their strengths and weaknesses. Childmind.org. Another option for treatment would be to prescribe an ADHD medication to alleviate symptoms. My recommendation for this patient would be to make appointments for testing at the child's school, as well as alternative resources that can do the appropriate testing for the child to assess the severity and, if any, diagnosis of the condition and create the best outcome of treatment based on the testing results. Based on the results, we would create a treatment plan for Andy to best treat the condition academically and, if necessary medically. Thank you.